My name is Jennifer Brock, and I'll be presenting a case today. My patient is a 54-year-old African-American female with a diagnosis of a CVA. Her chief complaint is that she's trying to get stronger and she wants to go home. She's aphasic, but we communicate through a communication board. She has a past medical history of hypertension, diabetes, hyperlipidemia, GERD, anxiety, depression, and osteoarthritis. She has no known drug allergies. She does have seasonal allergies with watery eyes and itching. Her social history, she smoked and she quit 8 years ago. She denies alcohol and drug use. She has limited family involvement. She has a daughter that visits once a week. She has financial concerns returning home. She's disabled, gets disability. Her family history, her mom has had hypertension, diabetes, stroke. Her father has had a heart attack, and her sister is obese and suffers with depression. Her health maintenance, she has not been up to date on. Her mammogram is overdue. She has not had an eye or dental exam in the past 3 to 5 years. She denied her flu vaccine. She's fatigued, review of symptoms, she's fatigued. She has occasional headaches. She denies shortness of breath, no chest pain, a normal bowel habits. She has right-sided weakness and pain to her knee when she ambulates. She gets dizzy with standing at times. She has anxiety and depression, no suicidal ideations, occasional increase of thirst, no wounds, and no problems with bleeding. Her blood pressure is 140 not over 60, heart rate 80, respirations 18, temperature 98.2, 98 oxygen saturation on room air. She's 198 pounds and her BMI is 32.4 kilograms. She is cooperative, she's oriented, she responds appropriately with the communication board. Heart rate regular, no chest pains, lung sounds clear, abdomen soft. We're discussing health, social determinants of health. Her challenge, I would say, is socio-economic, living paycheck to paycheck. She's concerned. Her housing instability, she's not sure she's going to be able to go home back to her apartment because it's on the second floor. She has limited access to transportation because she has to depend on her neighbors, and when they can take her may not line up with when her appointments are. She has limited healthy food access. She gets what she can get wherever she goes, and typically cheaper food is not as healthy. Healthier food is a lot more expensive. She does have lack of family support. I mean, her daughter visits once a week, but that's basically the support that she has. She does, I would say the racial bias and health inequity for African Americans is definitely against her. Studies have shown that African Americans with hypertension get less aggressive treatment for hypertension, and they face higher rates of inequity. So, that's something that we need to work on. Meeting with the case manager and the social worker and discussing on our visit, our anticipated needs for the patient. They're going to look into doing some meal deliveries at first until she can get healthier, and we'll see what other type of resources that we can get for her so that she can stay in her home and avoid her from returning to the hospital for the same health issues, same diagnosis. Thank you.